Confusing guidance from the Centers for Disease Control and Prevention is fueling a rise in measles cases across the US.
With the MMR vaccine, it's a good vaccine. But if you haven't reestablished that patient-doctor relationship, at CDC, we want that transparency. We want that education. We want that trust between that doctor and that patient.
More than 2,200 Americans were infected by measles in 2025, the most in more than 30 years. 3 died. And right now, the US is on track to exceed that total with 416 confirmed measles cases in 14 states. Of course, there are many other probable cases. These are just the CDC confirmed cases. The worst hit state being South Carolina.
It's very concerning for folks who are not immune to measles.
Measles is among the most contagious viruses. An infected person will transmit the virus on average to 18 others if those 18 haven't been vaccinated or previously infected.
2 doses provides 97% protection from any symptoms at all.
Already, the UK has lost its measles elimination status this year, along with other European countries, including Spain and Austria. The World Health Organization announcement follows the disease's spread for more than a year in those countries. And there's a real risk that the US is on a similar trajectory. Is the newly appointed CDC Principal Deputy Director worried by this? Apparently not.
It's just the cost of doing business with our borders being somewhat porous, global and international travel.
But fewer than 2% of US cases have been imported from abroad. Outbreaks happen when vaccination rates fall below the levels needed to maintain herd immunity, which is about 95%. In South Carolina, where we're seeing the surge today, the kindergarten vaccination rate fell to 91% during the 2024-25 school year. Now, this is likely in part down to distrust of government health officials and, for example, their vaccine mandates that developed during the COVID pandemic. It's worth noting, too, that in 2019, only 3 states had kindergarten measles vaccination rates below 90%. Last year, that figure was 16 states.
If you had a child today, would you vaccinate that child for measles?
For measles, what I would say is my opinions about vaccines are irrelevant.
But that's kind of your jurisdiction because CDC does give advice.
The Health and Human Services Secretary has fueled the distrust with his non-committal answers that, on the one hand, encourage you to get vaccinated, but on the other, sow the seeds of doubt as to whether it's the right thing to do.
There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves. And what we need to do is give them the best information and encourage them to vaccinate.
In November, the CDC updated a vaccine safety webpage to state that the claim vaccines do not cause autism is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism. It goes on to say, studies supporting a link have been ignored by health authorities. Much like his boss, Dr. Abraham claims that people should be free not to vaccinate children.
The president, secretary, we talk all the time about religious freedom, health freedom, personal freedom, and I think we have to respect those communities that choose to go somewhat of a different route.
The problem is that unvaccinated children can sicken infants and immunocompromised children who can't be inoculated, leaving some disabled or worse. Government leaders would be better off explaining this to parents rather than brushing aside serious illness as inconsequential.
They didn't even go through the panel again. They didn't go through the advisory council for immunization practices was not consulted about this new schedule. So you kind of don't know where you are on some of this stuff.